Back again live with Mr. Steve Price of Dental Associates. Today we're going to talk about root canal. Coach Price, I have a few questions. What the hell is a root canal, and why am I so damn afraid of them?
Oh, the dreaded root canal. It's one of the most feared words in the dental vocabulary. So let's talk about what a root canal actually is.
Like a colonoscopy?
Well, it's not as bad as colonoscopy.
Oh,
all right.
Good.
It's actually not bad at all. The technology's changed dramatically. They're completely painless now. But let's talk about what happens and why you need a root canal. So let's talk about teeth themselves. Nick, bring up that first x-ray.
Talk about practice.
So if we look at this, I know that many of you have not looked at dental x-rays in detail, but let's look at the three layers of a tooth.
What's that white thing up there?
That's a silver filling that it has. So let's disregard that. So the outside layer of a tooth is called the enamel, right? Underneath the enamel, a little bit grayer, is the second layer of the tooth called the dentin. And then the most gray part internally inside the tooth is the blood supply or the pulp. If you get a cavity is bacteria, it destroys the enamel on the tooth. It goes into the pulp, and if it gets really, really large, it gets into the blood supply of the tooth, and that's bacteria entering your body through the blood supply of the tooth. The tooth becomes infected.
Is the pulp like liquid?
The pulp is actually a blood supply and nervous tissue. Nick, let's go to the next slide.
Interesting.
So if we look at this, if you look at this is a plastic model of a tooth, and if you look at the red little lines, that's demonstrating where the blood supply is inside of a first molar, okay? So let's go back to the other slide. So if you look at this, the gray part, the most internal part of the tooth is actually where that blood supply lives, all right? So if you get an infection and an abscessed tooth, the abscess develops at the bottom of the root. Go back to that next slide, that plastic slide. So if you look at the bottom tooth where the lines are black and then there's two little red spots, that's trying to diagram what an infection looks like inside your jaw. Well, you can't live with that infection, so you only have one of two choices. We can extract the tooth, and of course the source of the infection is gone, but we don't want to lose the tooth if we possibly can save it. Or we can do what's called a root canal. And years ago, root canals were difficult, the technique was difficult. Today, with the treatment modalities that we have, they're extremely easy. They're 96, 97, 98% successful, and they're just a breeze for the patient to go through. So there's no longer the fear factor that you have to live with.
What's the time on something like this?
A root canal takes about 20 minutes to 30 minutes with no difficulty at all. So
is it not better to pull the tooth?
No.
Or have a root canal treatment?
No, let's not pull a tooth if it can be fixed. Remember, the fibers that hold the tooth in place are the outside fibers that are next to the bone. They're still vital. The tooth may be dead, but the actual fibers that are holding the tooth in place are still alive. So the tooth can remain in your mouth for the rest of your life. So let's look at a tooth that's infected on the x-ray.
Quick question, is the root canal a permanent solution? I mean,
yes, it's a permanent solution. Once you do the root canal,
okay,
the tooth becomes healthy, the infection goes away,
okay,
and the actual tooth becomes actually non-infected anymore, and you keep it for the rest of your life.
Cool.
So it works. Let's take a little bit of a break here.
We'll be back.
That was good. So now they understand what a root canal is.